growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, it's Dr. Steve Rasner. You're tuned into The Lionhearted. This week is part 2 of a podcast I started last week on a subject I've given you many times, and that would be having the courage and the commitment to make 2020 the year that you move your practice into a practice that provides oral sedation. And before you skip this, knowing I've covered it many times, I'm covering it from a different angle in these last 2 podcasts because it's that important to me. Because what I realize is no matter how much I advocate that you incorporate this skill set into your practice, most of you don't do it, or not enough of you do it. So what's the consequences of that? Why should I care? Because too many of my young colleagues and too many of my older colleagues continue to struggle with the kind of practice that I advocate for you, which is a fee-for-service practice, and a practice that's not bound down by the incredible negative influence of having a insurance-driven practice. How could you possibly enjoy dentistry in that kind of environment? And look, I know there's a lot of different situations of clinicians that are listening to me right now. Some of you are in an associateship, and of course you have to accept insurance, and I'll try to get to that in a few minutes. Some of you are starting. Your practice is less than 5 years old. And so, of course, I'm not telling you not to take insurance. You have to in the beginning. Do you hear me? I am so tuned in to the advice I'm giving you. I realize you're in different situations. Some of you are in, God bless you, in public medicine. You're servants of the public. You're amazing people that have dedicated an early part or a good part of your career to serving that portion of the population, knowing that you're restricted in your ability to enjoy freedoms of the type of practice I'm trying to give you. I guess I try to give you what I advocate because I know that it's still doable in 2020. That meaning that you can have a fee-for-service practice. You don't have to be a part of corporate dentistry. And if I give you the one skill set that I think is above, by far above all the other skill sets that can impact and change everything about what you do professionally each week from Monday through Friday, then why wouldn't I try to keep pushing that, which is what I'm doing. Oral sedation permit, which enables you to use the medications that I advocate, which are the combination of Benadryl, 25 milligrams, Atarax, 50 milligrams, and Triazolam, 0.25 milligrams. It's just unthinkable to me that I could give you something so simple that could so dramatically change your professional life. So here's how it does that. And in case you didn't remember, why do I use that particular spectrum? There's lots of other things you can use. The DOC, the Docs Institute, has a different formula than I advocate. It is because Benadryl has a sleepy sedation effect on patients, and Atarax has an anti-anxiety component to it. And here's the real mystery, to be honest with you. I'm not going to pretend that I'm a pharmacological expert, because I'm far from it. But I do have 24 years of using the exact recommendations I'm giving you. I've gone off track a couple times in trying to use other combinations. They're not even close. When you give 10 patients the 3 drugs I just mentioned, 90 minutes before, following the protocols that I'll give you if you write to me at drrasner@aol.com, If you give 10 patients that, 9.5 of them are going to be perfect for you, meaning they'll appreciate that they finally found a dentist that doesn't scare them, that they don't remember much of what happened when they were there, and that they're so happy with you that they'll boost your referral rate through the roof. And I am very sensitive to social media that says a statement like that, that tells you, listen, if you do this, I can get you 100 new patients a month using my new whatever they're recommending. Bull, you know what? I haven't had one of those things come close to fulfilling their promise. But I can tell you, getting a sedation permit in 2020, you're not going to explode your practice in 6 weeks. The community needs to know that you're that person. And they can know that easily within 6 months. By the second half of this year, you will have patients coming in. First of all, don't we all have patients that are scared? Whether you have a sedation practice or not, you have patients that are fearful. So what's your solution? Nitrous oxide? Give me a break. That's the 4th drug I use, by the way. But using that alone is not a solution to scared patients. That does not differentiate you in any way, shape, or form. But having a permit, which you need to give more than one drug, so the permit permits you to give a combination of drugs, you are achieving moderate sedation. So remember, why is that the perfect combination I've come up with? Well, number one, it's been safe and predictable for me. So in 24 years, I've never had an incident. There's nothing I can give you that could be more profound than that or more safe and predictable. I've never had to come close to calling 911. Why is that drug the perfect combination of drugs? Well, I have 3 to 4 hours of working time. That's about perfect for me. Full disclosure, I've used this combination for many, many years, as I've just told you, and I've had patients that have been in my chair for 6 hours, that I've given them a second pill 4 hours into it. When I do that, and you need to get my full protocol by writing to me at Dr. Rasner at AOL. When I've given that pill, it's crushed. The triazolam only. I don't give them all 3 pills again. I only give the triazolam. It's safe and predictable. It is marketable. Okay, here's the thing. So let's talk about this for a minute because it's worthy of revisiting. So why is that the most marketable skill that you could take on in 2020? Why wouldn't aesthetics be the most marketable skill? Because many more clinicians, believe it or not, know aesthetics than they know sedation. It's true. And you don't have to get a permit to do aesthetics. And when you knock it out of the park and do the most beautiful roundhouse of porcelain restos that you've ever provided by the best lab in the country, a lot of people want to keep that a secret. They do. They don't want to go tell their cousin that they haven't seen in 3 years when the cousin says, "You look amazing." "Oh, yes, it's the $30,000 I just spent on my teeth." I mean, some patients are like that, but very few. So even when you knock it out of the park, it's a secret to many members of your community. Do you really think anybody's going to rave about the root canal you did? I mean, they may tell a couple people that they had a root canal and it didn't hurt at all with Dr. Rasner. They may say that, but it's not going to make your phone ring off the hook. And that's the intention of these podcasts. So this part of this sets the stage for everything else I tell you. How are you going to get back to your community, which is a fundamental cornerstone of bonding with your community, of becoming an integral part of your community under my platform, The Lionhearted? How are you going to do that if you don't have enough patients, if you're struggling with cash flow and paying your bills on time? How are you going to become that magnificent, fair, cool, and collected owner of your practice so you can maintain a staff for 20 point some years on an average of 20 employees that I have? How are you going to be able to do that if you're uptight every Monday or every Friday because you don't have enough money to pay your bills. I so get where a lot of you are at. That is why I'm spending this time. I am not telling you to not become proficient in aesthetics. I would tell you that if you can afford it, and even if you had to borrow for this one skill, I would not tell you to borrow to have this stunning, gorgeous waterfalls and 72-inch television screens in your office. I wouldn't tell you to borrow for that. I would tell you to make it Walt Disney clean and delegate different members of your team so that everything, every minute of every day that you're open is pristine and clean within your office. It may not be 2020 A-Deck dental equipment or gorgeous art or granite throughout your waiting room, but it could be Walt Disney clean. And you certainly can afford a rug or a new floor for your reception room and work backwards. You can. So, that's why I'm telling you, the biggest way to get to the rest of the lion-hearted equation is to start with enough patients that want your skills. So if it was me, I definitely would be learning aesthetics, something as early in my career, every year. And I would probably choose the Spear Institute. And I would also be a big fan of you taking Strupp in Clearwater, Florida. But I wouldn't do that without getting a sedation permit, because it's the biggest impact on you. Because when you create an experience, which you're going to do, where not one patient, you're not going to get 1 out of 10. You're going to get 9.5 out of 10 that have this amazing experience that, by the way, never had that before. They are going to tell everybody, because that's not weird to tell other people. That's not unusual. We all know what our reputation is. We're the scary profession to go to. People aren't scared to get their hair cut. They're scared of the dentist. They're scared of the proctologist. Okay? I don't know what he can do or she can do, but I know what you can do. You can create and attain a sedation permit in your state or your country. And there's not one country you can't do that in. And by the way, if they made me get a IV license, because some states I think do that, only a couple, will make you get an IV sedation license in order to dispense the combination drugs that I told you about, then I would do that. It's that impactful. Even if I never intended to IV sedate a patient, I would do that. I mean, if you can't tell from my voice and see it in my eyes how game-changing this is, then you're not watching me or you're not listening to me. That's why I'm hammering this to death, particularly 2 podcasts in a row. So my point is that you could be the most aesthetic dentist in Beverly Hills or Indiana, but it's not as impactful as oral sedation permit is. You could be the best GP endodontist in the country. You could have been an endodontist if you wanted to be. And that is a skill that I think the GP, lion-hearted GP, should learn how to do. I do. There's a number of skills that you should be on track to learn in those first 10 years. And if you haven't got them in the first 10, then start now. But at the same time, you need a sedation permit that you're going to have to renew every 2 years with 20 hours, not a big deal. Because it's going to bring you in a bevy of patients that will go out of network, finally, to go to you. And then you'll be able to sit back, finally. And trust me, this isn't my philosophy. It's based on a number of clinicians over the years that indeed have listened to what information I'm giving you and have written me amazing letters. I'm on vacation for the first time in 15 years of my practice. I owe it all to you. I'm enjoying dentistry like I never thought I would. And a year ago, I was thinking of getting out. Look, I know if you're in that mental state of you're burned out and you're not at a good place right now, maybe you're an associate, I'd still get the permit this year. So you should be on track to get several things done at the same time. Because for one thing, it'll make you the most productive associate in the dental practice you're in right now. I don't think you understand, unless you're doing it, how amazing it is to be a part of this kind of a practice. And by the way, if I'm confusing you, I'm not saying every patient gets sedated, but I will tell you it's, I haven't really tracked it, but it's every single day, and it's multiple patients per day. And it's so predictable and consistent. Imagine walking in to the dark room with a soft snoring purr, and you tap the patient and let them know that you're here and you're ready to work, and they like nod their head a little bit. It's calming for you. I don't think you appreciate it yet. You don't have patients, ooh, ow, moving fast on you or interfering with your ability to provide amazing outcomes. It gives you the break to walk away. And I know this sounds funny and maybe not copacetic to some of you, but they don't know that you walked away anyway. You can walk away and take a break. You can go down and do a real nice hygiene check. And as long as you have staff available that are monitoring the patient. Every patient I work on, and you know that you need to get the full protocol from me. Every patient I work on, of course, and every patient you work on with this protocol needs to be fully monitored for vital signs. And really the only thing that's going to happen is once in a while the oxygen concentration monitor will go off and drop below 90 something because the patient may start to fall asleep and not breathe as deeply. And it requires you pulling their lower jaw forward and opening their airway. That's not an emergency. Most of the time, we can just tell the patient, take some deep breaths. I mean, you just don't have an idea of how amazingly everything it is about it. It's profitable. Oh, by the way, let's talk details. A couple details you need to know. I don't charge for it. I've calculated it cost $8 for the 3 pills. And of course the gas, I don't know how much the gas cost, the nitrous oxide. And yes, you need all 4 if you're going to emulate the level of sedation that I have. So let's talk about the nitrous for a minute. The purpose of the nitrous is to get the patient to the level of sedation that you're trying to achieve that is comfortable and safe. I said comfortable and safe. So if they come in and they're sleeping in my reception room when we go to bring them back, by the way, you need a wheelchair, and all of this you'll get in writing from me when you write to me at Dr. Rasner AOL for the sedation protocol. And I update it all the time. Like I'll give you an example in a minute of one of the changes that you need to make. But if they come in and they're out of it, I'm not even using nitrous. I just put the oxygen, the cannula on their nose, and they're breathing oxygen. Most of them are on 30% of nitrous, and that produces that purr snoring that I'm talking about. Now here comes the part that's a little difficult. If they are difficult patients, remember I said 95% are rock solid for this. But you're going to have 5% that may say, I thought you said I'd be sleeping. Like if you walk in the room and they're on the phone, they're talking, sometimes I allow the significant other there in the beginning, because you're going to get patients that are going to blow your mind that you didn't know existed in your community. And they need a significant other in that operatory. And that's okay as long as they don't speak to them. But if you walk in and they're having conversations, they're on the phone, you can't have that. There's certain lines you have to draw to make the drug recommendations effective. And one of them is no phone. I want the phone off too. I don't want it ringing. They can have a significant other in there rubbing their leg. No conversations going on. We have to give it the chance to work. If you walk in and they say, I thought you said I'd be sleeping. It's not over. It's not like a game's over. This isn't going to work. You can up the nitrous up to 50%. And that's it. No more. I'll tell you why in a second. And you can give them a second pill of triazolam only crushed under their tongue. Don't give all 3 pills again, just a triazolam. If that doesn't work, abort. You lost 2 hours, 3 hours. It's one of those percents. What you don't want is to be in the middle of a procedure with somebody that's driving you crazy. Now, I'm saying that to you with clarity because it's one of the ways I've probably changed in the last 2 years. Like, I could work on those patients, I just don't want to. They need to be IV sedated. It's just not worth it, especially if it's surgical. You know, I have a lot of friends that are in advanced courses and classes for implant dentistry and surgery that tell me that I ask them, well, how did you sedate the patient? And of course, many of them IV sedate those patients, which is what some of them absolutely need. And I'm simply making it clear to you right now that you don't want to be caught in a procedure that you really kind of resented or regret beginning because this patient should have been IV sedated. Okay, so again, if you go into that 5%, and you don't know at the time that they're in that 5%, but if you go in there and they're wide awake, you give them a second pill, the second pill works much more effectively because you're crushing it, putting it under their tongue, and just letting it dissolve. If they're not cooperative within 30 minutes, then you're done. And it's happened to me. It's absolutely happened to me. And I'd rather be in that than then be deep into a procedure and realize I should have IV sedated them. So there's a lot of other innuendos and details that you need to know, but that's just a brief glimpse of, and that just doesn't happen that often, I have to tell you. Let me tell you one more thing that I was thinking of when I was telling you this. Saying this to you because I said the significant other will be in the room. You have no idea right now, if you haven't done this, in your community, whether you're in Poland, Australia, Canada, India, Italy, wherever you're listening right now, how many patients have not sought treatment because they're so afraid due to past multiple negative experiences. In other words, they went to somebody that said they do sedation, that can handle that patient, but doesn't have the whole thing down. And when I say the whole thing down, I mean all the minor little behind the scene things that you need to know. You can't have people walking in your operatory talking loud, talking at all actually. It is a quiet zone for sure with music, and that's it. You talking very low with your other staff members if necessary, or them writing messages to you. It's not next hygiene doc. None of that can go on. And these patients can hear you in many, many cases, even if they're sleeping. But you have no idea how many patients aren't coming to dentists right now because they just don't know anybody that they trust. And the beautiful thing is that 95 out of 100 times when they meet you and you execute the protocol the way I tell you to, which includes many things. It includes not working on children. I don't advocate you sedating anybody under 17 years old, and I don't advocate you doing anything other than ASA 1 and 2 healthy patients. You heard my numbers on the last podcast that I had in 2019. North of $4 million for my 2 offices. North of 3.5 just for me. And I will tell you that that is because when you have a patient in a chair and you walk in and you say, so how did you find me? And they say, well, you worked on a lot of the people I know, and you know they're there because they're scared. Okay, as soon as you hear in your cliff notes of new patients that that's why they're there, you got them. They're going to say yes. It's just a matter whether they can afford the recommended care that you're going to end up making that day. It's a beautiful thing. You know, nobody talks about it, right? But we all would be amazing, amazing dentists if we could do anything we want to do because money doesn't roll into it. Most of us have the epic challenge of giving responsible treatment plans for patients that have less money than they actually need. Can you imagine how much more ortho you would do? How many procedures that you would just incorporate? Most of us at some level have to compromise to some degree. We have to segment our treatments. And I know that's true for the abundant of clinicians that listen to me. And what really differentiates you from being a great clinician and being a quack that makes a lot of money is being responsible. Really saying to yourself sometimes, I wouldn't recommend anything because you can't do enough for me to be responsible. And you get to that level a lot easier if you have abundant patients coming through your door because if you have abundant patients coming through that are attracted to your office because of fear histories that they had, then you're going to be more in a position to be very selective about doing the right thing all the time. When you're desperate, I think sometimes you try to be a hero. And when you try to be a hero and make poor treatment planning decisions and maybe do things that are out of your realm, like an ASA3 patient or a child, then I think you're going to enter a world that is, if nothing else, give you a lot of angst. And I am always about those that listen and follow the lion-hearted principles about you having a practice you can be proud of. Not just a practice that is productive and lucrative. Of course I want. You deserve it. What we do is really, really hard, in my opinion. I've never come on these podcasts and say, this is a breeze the way I do it. I have made it a model that makes it very, very rewarding to me as a dentist, and I think rewarding to patients that buy into my philosophy, which is comprehensive care. And you know that if you're listening. And it's a real challenge for you and me to provide comprehensive, responsible care when budgets are limited. But there are ways to do it, many, many ways. And we're going to talk about that, on the next podcast. We're going to talk about treatment planning the patient that has financial compromises and staying responsible. Sometimes you'll end up doing what I call putting out the fires cases. So that's a patient, they may lose a number of hopeless teeth. They can't afford 4 root canals. They can't afford sophisticated tooth replacement, but they're not a denture patient. They're not a patient that's easy to say, oh, you're in a terminal dentition, your teeth are done. They're patients that simply can't afford in their budget the type of work that perhaps we would like to do if we had total freedom to do anything we wanted to do. But I believe the lion-hearted practice should be the practice that is very productive, that you go in there, you don't waste your time. That is lucrative at the end of the year because it is hard work. You deserve to be paid and you deserve to be profitable if you treat patients the way I advocate that you treat patients. We're not a clinic here in a lion-hearted. We're not corporate dentistry in a lion-hearted. Our bottom line is quality care that's not free. I tell my patients that I meet that are new, I said, I'm not the dollar store here. I'm not the dollar store, but I believe you will more than be happy with the outcomes that you get by coming to us. There's a lot to talk about in 2020, and I think that's enough for this podcast. I appreciate so much those of you. It's pretty clear to me who listens to me at this point. I'll help the 3 of you that listen. I'm kidding. I'll help those of you that tune in that want a real model that I've been doing for 39 years that can bring you a lot of joy and satisfaction in 2020 and many years to come. Thanks for tuning in. I'll see you next week on The Lion-Hearted.